Good morning, Mr. Chair, Commissioners. I handed out our latest numbers. You can see since May 25th, the number of cases in Clay County are 373, and we have 24 deaths, and that will be updated every day at 11. So that's where we're at right now. The numbers I just received no longer needing isolation are 90. So those are ones that are off the, have followed through with all of their isolation. In North Dakota, they call it those that are treated, but we call it no longer in isolation on the Minnesota side. And the number of deaths is still, I mean, it's unfortunate that we have deaths, but it's still low, and the hospital systems are still managing with those that need to be hospitalized and those in ICU. So they're managing both on the Fargo side, and then the hospitals throughout Minnesota are also managing those cases. So that's good that we're able to manage those without having to secure other settings, et cetera. We had a mass testing event this weekend that came up fairly quickly. We were notified on Friday about noon. The press release didn't go out till probably 3, so they did a fairly fast ramp up to do mass testing at the Armory here in Moorhead. And so that went on Saturday, Sunday, and Monday. From 9 until 5, or actually they started at 10. Some of the days they opened up a little early. We tested somewhere between 855 and 875 residents. So I think the numbers could have been higher.
Is that a 3-day total or 1 day?
That was a 3-day total, 855 to 875, around that. So again, I think the numbers could have been higher with a little bit better notification, but that's just how it went. The Guard also did not get much notification in regards to this event either. It happened at all the armories across the state of Minnesota, and I believe there were 6 armories. Each armory had 1,100 tests available to do. So we didn't complete our 1,100 tests. I don't have any information on the other armories and how well they did. My public health staff had to be there all day, all those 3 days. So we had a number of staff that were willing to do a little bit of time at those events. And so we were able to cover. The National Guard was really looking for a lot of assistance and direction in providing this. They were both, they did testing both inside the armory, but they also had some drive-up capacity, so they could test those people that wanted to stay in their cars. And you know, we had, it went pretty smooth for the short notice. So unfortunately, I wish we would have had many more tested, but that's how it went. So 855 to 875. Those results go to the Mayo Clinic. That's the lab that was providing is going to provide the testing results. So we'll see kind of what the outcome is of the testing from that site. So we'll see how that goes. The testing continues for long-term care facilities and assisted living facilities in Clay County. That is happening also at their sites, and it's testing the staff, and it's also testing residents. Now what Minnesota is doing is they're going to do a series of 3 tests. So they'll do an initial testing of everyone, and then 7 to 14 later they come back and do a second testing, because the testing of course only shows what's happening that very day. And then the third time they'll come again 7 to 14 days later. So there'll be a series of 3 different tests in all of those assisted living and long-term care facilities. So we have one facility today. I think there's another one on Friday. So the National Guard is going to those sites and providing the testing. There's also testing on the North Dakota side. They have about 3 sites set up, and they have, we made the request to do our corporate Congregate settings, they were not on the list with the assisted living and long-term care. So we made the request to include those because we do have some outbreaks in those congregate settings. Now, the governor's office of North Dakota agreed that we could have Minnesota staff from those facilities come over to their North Dakota sites and get tested. So that's very good. So that's going on today. So we sent that information out to all of our congregate care settings, and they can have staff go to the North Dakota sites in any of those 3 sites that are going to be doing the testing. We also sent that out specifically to those facilities when we did the mass testing this weekend, just so they would get some information. So we may have had some that did come over to the Armory and get tested as well. So we wanted to provide every opportunity for those facilities to get tested. So that was good. Any questions on the testing, or we should be hearing back. I believe it was about 48 hours to get the testing results back from the Mayo Clinic. So.
What kind of testing do they do in a long-term care? I mean, now at the Mort Armory, they're going to do 1 test. Now you say the long-term care, they're doing 3 tests.
Yes.
So what's the difference between the 2?
Well, it's a setting with high-risk individuals, and we are fully aware across the state of Minnesota that those healthcare workers are really bringing it in. They're asymptomatic. They don't know that they have the virus that they're carrying, and they're bringing it into those facilities. So we want to stop the spread in those long-term care facilities because it is far more detrimental. Those individuals in those facilities are typically the ones that would be more critically ill because of their health conditions and their age. So what they're trying to do is try to catch those early with positive cases, and then be able to deal with that. So if it's a positive staff individual that has no symptoms, then at least we can get that person out of the workforce.
Is it the same test that they're doing?
It's the same test.
Oh, they're just doing the same test 3 times.
That's correct. Yes, they're doing it just because that 1 test, it just gives you what is happening with you today. You can be positive in a few days after that test, so
right.
You might not show the virus initially. So we're just trying to protect those that are most vulnerable, and so that's why we're doing those congregate care settings.
Mr. Chair?
Yes.
First off, on behalf of our board, if you can tell your staff thank you for, I'm sure that was short notice, and then on a holiday weekend to have to go over and do that. Make sure you give our thanks to them for that. First, congregate care, are you including nursing homes and assisted living types? All those fall under that?
Correct.
Okay.
Yes.
Because I've had people ask me, they didn't look at that as necessarily being nursing homes when they hear that term.
Sure.
So, but we're including that, all of those things.
That's right.
Okay.
And the congregate care also is, some of the corporate foster care
Right.
homes that have individuals as well. So yes, all of
And,
that.
and why, what can we do to push antibody testing? When we're testing everybody and they might, and we're going to test them 3 times over the course of 21 days or whatever, or 28 days, whatever that is. And wouldn't it be nice to be able to do that simple little blood test to see if they have the antibody?
Yeah, they're not pushing that out. For many reasons, they're still trying to determine the efficacy of that. So they're still, that's coming through the medical.
But the more of that being done, wouldn't that help that study?
Yeah, I don't know enough about the antibody testing other than they're saying that the accuracy of that is also, they're unsure about that.
Okay.
So they don't want to do the mass antibody testing. It will be nice when they can do that, obviously, but at this point in time, they're not ready to do that mass testing in those facilities.
Thank you.
Yes. The other sheet I sent out, that is really the phases of the governor's stay-at-home order. So you can see the dates, and then he talks about each of the settings, so the social settings, critical business, non-critical business, the retail, restaurant, and bars. And then there's one on the back page. There's 4 sides. Personal services, And then he talks about gyms, entertainment, like bowling alleys. So it's very well laid out. Outdoor, school buildings, childcare, youth programs, organized youth sports. So it gives you kind of an idea of what his order is. And then at the top, I know the print is very small, but it talks about when the stay-at-home order was initiated, and then phase 1 goes through June 1st, and then phase 2 begins June 1st, and then we don't have dates for phase 3 and phase 4. So at least it gives you an idea of what he's talking about, what are the gatherings that he's looking at in regards to even like the religious facilities, what kind of gatherings is he mentioning when he talks about the phases. So that gives you at least a snapshot of his plan. And we know that will change.
So Kathy, what's his criteria from being able to move from phase 2 to phase 3? Or do we have to wait to see what that is?
Right, he will be announcing that to see what his criteria will be for that. But he's looking at the data and the numbers. He's still a big believer in, we still have to manage that social distancing. We have examples from other states where they've lessened that social distancing, and now they've experienced some outbreaks.
But has he said what he's looking for, or what's going to be, what has to be met for him to do phase 3?
He hasn't given us a specific, what does he have to meet, but he is looking at hospitalizations, he's looking at the deaths, and then he's looking at the numbers of how they're ramping up in Minnesota. So he hasn't given us specifics. We're looking forward to when he makes that announcement about what he'll do after June 1st.
Kathy, is there any inclination if he will do a phased reopenings based on different areas of Minnesota? There are areas in Minnesota that are significantly different than what the metro is experiencing.
Right.
Has that been part of the conversation?
It has been part of the conversation with the governor. I know that's been brought forward with his team, whether they can make some different decisions based on where you are in Minnesota. We haven't heard what he's going to do with that, but that would be something that's been brought to his attention.
What area do public meetings law? I'll take this one for example. What area do we come under here? What protocol do we have to follow? I mean, right now we're trying to be 6 feet apart.
Right.
Do we still have to maintain that distance, or
Right now you do.
is there something that says we're supposed to maintain it?
And I consider this, it's a critical business, so I would say that's, yes, the 6-foot distancing is still in play with that. The gatherings of 10 or less is still part of his plan. And then as you look down, when he talks about, so we're in phase 1 until June 1st, and then we go to phase 2. So you see, even in social settings in phase 2, beginning June 1st, it's still gatherings of 10 or less. He's mentioning that critical businesses are open. Right now, the way you're sitting, you're maintaining that 6-foot distancing. So that's still pretty critical. The 6-foot distancing he's not lessening up on. And the gatherings of the numbers of people is still something that he's looking at. What are the numbers that can be, for instance, North Dakota, loosened up their numbers of how many people could get together. In Minnesota, it's a bit different yet. But as Commissioner Mojo said, hopefully there will be some different decisions made based on where you are in Minnesota, because it's not a one-size-fits-all in this state.
Okay. Thank you.
Kathy, I just read an article this morning, and I don't know if there's something that they're looking at in the state of Minnesota, but I saw an article that in California there was suicides are up 800%. Just during this pandemic period, of 1 month period. And I'm curious if we're paying attention to those types of things as public health in Minnesota as well. I think the number, when you start talking about California, I think they were saying that number was extremely high.
Yes.
You know, like, it was in the thousands.
And I know that's been, that's been concern across the country, because I know they've talked about that, watching people's mental health. We've talked about it a number of times on our press conferences that we have every week. We've talked about mental health and resources, particularly around here. We talk about, First Link, 211, the mobile mental crisis team. So we are paying attention. We have some social workers on our task force, or on our team as well. So we're doing what we can to get the information out. But yeah, that's pretty serious.
And they're tying it to, a lot of it to lost work and
Sure.
those types of things.
Right, the stress of what that puts on, the burden of people losing their businesses, and
Yep.
it's tremendous. So, yes, we've at least brought that to people's attention about maintaining your mental health, and that there are resources out there. So we hope people avail themselves to that, and that message has been passed on pretty regularly. So that's unfortunate. Anyone have any questions that I haven't provided information on?
Briefly, in congregate care, I think our detox facility and jail, are they in that grouping?
They are not. They could avail themselves, though, to the testing.
Okay.
So they were testing anyone that came through the armory testing this weekend, and then the testing in North Dakota as well.
Okay.
So they're not included in that testing.
And that's not a concern at this point?
It hasn't been. Our jail's been doing a very great job of managing with their screening and the way they have isolated their people. So they're doing a really good job. Okay.
All righty, thank you, Kath, for the update.
Thank you very much.